Hey guys, Dr. Matt here from Robin Wellness Center, and I am with our intern, Kaylee. Kaylee, say hello.
Hello.
And sun's out, the guns are out. Give us a quick flex. Look at the guns on this young lady. So today we are going to talk about lower back pain, and there is a myriad of reasons that people get lower back pain, but we're going to talk about one of the ones that's probably a little bit lesser known because it's kind of a collection of different causes, and that is called lower cross syndrome. All right, I want to use Kaylee here as an example. Imagine she is here facing this way. This is what her spine looks like facing this way. We're going to put it right over here for one quick second. But what lower cross syndrome is, it is tightness of these muscles coming right down the front, right in here, turn around. Tightness of these muscles coming down the paraspinals, the lumbar spine, hence the cross, and then weak and inhibited gluteal muscles or the butt muscles, and weak and inhibited ab muscles. And what that is going to cause is an asymmetry within the body, and it creates different postural misalignments, and it creates pressure within the spine that's going to cause that lower back pain. Now, because we're really tight in here, these muscles in here, it's called the iliopsoas, it's a collection of two muscles, they can take and they can draw that lumbar spine forward if they're too tight, because the abs aren't keeping it back, and it's going to cause compression of the intervertebral discs. It's going to create these facet joints in the back to compress more, because if it's drawing it forward because it's tight, all these joints jam in the back right in here. And because I've been practicing for almost a decade now, all the studies show that if you have better posture and a stronger core, you will have better outcomes with your care, whether you came in with headaches, mid-back pain, low back pain, neck pain. Regardless of the initial symptomatic complaint, if you have a stronger core and better posture, you will have better outcomes. Having that lower cross syndrome, weak here, tight here, and tight here, will bring you out of that normal general alignment, which means your weight or the stress and the gravity of life, instead of having all of that go and distributed evenly throughout the spine, as you deviate away from that normal postural alignment, you have more gravitational or loading pressure either put onto the discs in the front, the facet joints in the back, left side of the spine, right side of the spine, and bottom line, the more pressure that you put on something that it's built to handle, it will break down quicker. And we're going to show you in a few videos later on how we can help keep that from happening. Until then, Dr. Matt and Suns Out, Guns Out Kaylee from Robin Wellness Center.